Get started. Hello, everyone, and welcome to Lupus and You Answers Advocacy in Action. I am so glad you're joining us this evening. We have a great program today, and I'm looking forward to all of our presentations. My name is Leanna Bennett, and I'm the Walk Manager with the Lupus Foundation of America. I oversee the DC, Maryland, and Virginia areas. I am here to be a resource for all of you, so please do not hesitate to reach out during or after this program with any questions. First, I'd like to thank our presenting sponsor, GSK. GSK is such a wonderful partner and supporter in many aspects of what we do here at the LFA, and we are so grateful for them. I'm also thrilled to have a patient engagement liaison from GSK here with us and a part of today's program. Before we begin, I have a few housekeeping items to go over. If at any time you have a general question that you would like to submit to our speakers, you can add it to the chat. We will have time at the end where our speakers will be able to answer those questions. Again, don't forget to mute your mics and keep yourself muted for the duration of the program. This keeps the flow of our presentations tonight from being interrupted and saves more time at the end for any questions. Finally, this program will be recorded, and you'll receive a link of the recording along with helpful resources and a post-event survey where you can submit feedback about today's program. Now to our agenda. It's a brief overview of tonight's event. I will kick us off by sharing more about the Lupus Foundation of America and some helpful resources and ways you can get involved. We also have a lupus warrior here tonight to share her story and experience with us, and then we'll go right into our amazing speakers. And then again, as I said, after all of our presentations, you will have the opportunity to interact with our speakers during a Q&A session. And with that, let me get started on more information about the Lupus Foundation of America. Here at the LFA, people affected by lupus represent the heart and soul of our foundation. You are the central focus of everything we do and are a constant reminder and serve as a reminder of our mission's urgency and serve to motivate us to continue this fight. To put this simply, our goal at the Lupus Foundation of America is to one day end the impact of lupus and its suffering while ensuring that we provide the comprehensive support and programs people with lupus need today. Our programs stand upon three pillars: research, care and support services, and advocacy. We have redefined lupus research to expand our efforts beyond just funding research grants. We are engaging all stakeholders to identify barriers that stand in the way of progress and setting a course to overcome them. And we do this by providing caring support for people affected by this devastating disease and leading advocacy efforts to bring more funding for research and services. Our research is patient-centered and focused on transforming lives. We have three goals: identify the causes of lupus, discover better ways to control symptoms, and ultimately find pathways to cure lupus. We know that people with lupus are also so important to the research process, and that's why we developed a new online research platform called RAY. RAY stands for Research Accelerated by You. No one understands lupus better than those living with it, and you can advance lupus research right from the comfort of your home by participating in RAY. Share your experiences with lupus, help inform future clinical trials, and really identify the most pressing needs of people with lupus when you are able to participate in RAY. We also have our National Resource Center on Lupus, which is your one-stop resource for all things. Head to lupus.org/resource to find this information so you can make informed decisions about what is right for you. We also have certified health education specialists who are trained to provide people with lupus, their families, and caregivers with non-medical counseling, disease education, and helpful resources. Our health educators can help you find trustworthy information to answer questions about lupus and how to cope with it. To contact a health educator, fill out our online form at lupus.org/healtheducator. Next, we have a program called Take Charge, which is a 12-week education email series for people with lupus, including those who are recently diagnosed. When you sign up, you'll get an email from our health education specialist with tips and resources that can empower you to take charge of your health. The series covers important topics such as identifying and tracking your symptoms, sticking with your treatment plan, and getting the most out of your doctor's appointments. Find more information at lupus.org/takecharge. We also have a program called the Expert Series, which is a monthly educational podcast where our team interviews experts in the field about topics that are important to you. We also have more than 150 support groups across the country where people with lupus can come together, ask questions, and listen to others. Finally, you can join our online support community where members can engage with each other and ask questions and connect. This program is called Lupus Connect. Moving on to ways you can get involved with our organization and support the fight to end lupus. We have a program called Make Your Mark. It's our community fundraising program and a way to turn an event into a fundraiser for lupus. You can also get involved through advocacy. Your voice is one of the most powerful tools we have, and we are the leader in stimulating federal support for lupus. Every day, we fight to ensure the government is responsive to the needs of the 1.5 million Americans living with lupus. This past April, hundreds of lupus advocates joined us as we gathered for the largest lupus advocacy event in the nation to learn from experts in the lupus field about the latest in lupus research, advocacy, and care, and to meet with members of Congress to earn them to join us in the fight. It was such an amazing day advocating for lupus warriors and meeting people from across the country. If you're interested in learning more about this event or ways you can get involved, in advocacy, head to lupus.org/advocate. And finally, you can get involved through our Walk to End Lupus Now program. We are back in person this year and are excited to continue bringing this community together. As I shared earlier, I oversee our DMV region, so I wanted to highlight our Baltimore, DC, and Richmond walks taking place this fall. If you are not local to the area, I can help you find a walk near you. I know there may be individuals from other areas here today, so in addition to finding walks near you, if you're interested, I can help you find local support and connect you with resources in your community through our network of chapters and regional offices. They offer local programming, support, and events, so please feel free to reach out to me if you need assistance finding support in your region. Finally, here is where you can find us. Check out our website, follow us on social media. These are great ways to stay updated on all of the programs and events and services that I mentioned today. I can also share any specific resource with you after the event and answer any questions in the chat if you need. So thank you so much for your time as I walk you through the organization and the resources that we have. And I'm now really excited and thrilled to introduce our next speaker. So I had the privilege of introducing Racquel Dozier. Racquel was diagnosed officially with SLE in 2004, but the onset of the disease started in 2002 when she was given a firm diagnosis of rheumatoid arthritis. After several hospitalizations with what was thought to be rheumatoid arthritis and medication issues, lupus began to rear its ugly head in her body. Once diagnosed, Racquel realized there was little to no support or access to information about lupus, so she quickly educated herself as to what sort of life changes she would need to make, as well as how to treat her newfound disease.
Why? Because it's working, so just leave it and we'll listen to it.
She realized that her story could touch another person who may be afraid after a lupus diagnosis. Racquel understood she could educate others about lupus and formed Lupus In Color. Lupus In Color is an international support group dedicated to educate, inspire, encourage, and empower lupus and autoimmune warriors.
Talk about the Lupus Foundation and what they do and what advocacy is and all of that kind of stuff. So now this is.
Oh, excuse me. Would you mind to mute yourself?
No.
Perfect. So yeah, Racquel, it's been so amazing working with you and getting to know you, and I'm so thankful to have you here today to share your story. So I'll stop sharing my screen and turn it over to you to start.
Thank you so much, Leanne. Thank you to the Lupus Foundation of America for inviting me to speak with you all. As Leanne stated, my name is Racquel Doge. I'm the founder of Lupus In Color, an international organization where we support lupus warriors all around the world. I was originally diagnosed with lupus in 2004 with, of course, like Leanne stated, a firm diagnosis of rheumatoid arthritis in 2002. after so many different issues that I might have had, ascites, had to have a hysterectomy, all of these different things that have come up in my life have really made lupus so present in my life. I was not diagnosed with lupus until it started to affect my organs. And that's where the ascites came in, because it started to affect my, what is it called, y'all? Oh, I just had a brain fart. It started to attack my intestines. And I had about 4 liters of fluid in my belly. And it was at that point in time that they stated that it was lupus, because it started to affect my organs. Since then, I've had several other organs affected. Recently, I've been dealing with some scleritis issues that are moving towards a Sjogren's issue. So that's why I was invited here today to talk a little bit about that, and how that, it really does affect your personality, because with the scleritis, which is the inflammation of the whiting of your eyes, with the scleritis, it's very hard to be able to see. It's very hard to keep your eyes open, keep your eyes closed. So since I've been having so many issues with my eyes, the doctors are leaning towards Sjogren's with other issues that I have been exhibiting. So it's just been it's been a difficult path, but it's been a path that nonetheless has me here today. And that is the best part about it. Even though I've been diagnosed with rheumatoid arthritis, lupus, I also have type 2 diabetes, the whole scleritis going into Sjogren's. And I've also dealt with Raynaud's, but that was very early on in my diagnosis, when they were trying to figure it all out. And, that hasn't reared its ugly head again since. So I'm excited to be here with you all. I just want to leave you with some, positive thoughts for yourself. Even though you go through some difficult times and it might be rough with the things that you might be going through, just keep your head up, give yourself some grace, extend yourself some compassion, and allow yourself to go through it so that you can heal a little bit from it. Thank you.
Thank you so much, Raquel. It's always wonderful talking with you, and so amazing to kind of hear your words of wisdom and guidance here. So thank you so much for joining us tonight, and excited to always have you a part of this event and work with you. So if anyone has any questions for Raquel, you can always add them to the chat, and I'm excited to introduce our next speaker. Tonight we have Dr. Tim Kaniecki here. Tim Kaniecki is a rising second-year rheumatology fellow at Johns Hopkins. He completed his medical education at St. Louis University and internal medicine residency at Johns Hopkins. His interests lie in the management of the multi-system complications of rheumatic diseases and in medical education. Thank you so much, Dr. Kaniecki, for your time this evening. We're so thrilled to have you with us and to learn more about Raynaud's and Sjogren's. I will now turn over the screen share for you to start sharing your presentation.
Yeah, thank you so much, Leanne. And thank you, Raquel, for sharing your story with us. And it's an honor to be speaking with all of you today and to share what little I can about some of these very complicated topics. And let me share my screen for you all. And is everyone able to see that okay?
Yes, looks great.
So as you all know, today we're going to talk about Raynaud's phenomenon and Sjogren syndrome and how that relates to lupus. And I want to give a quick shout out to one of my colleagues, Dr. Rachel Walwork, who's given this presentation in the past. And some of these slides are adapted from some of the presentations that she has given. And I have no disclosures tonight to speak with you all. And as far as what we're going to talk about today, on a very kind of general level, we're going to talk about Raynaud's phenomenon, or Raynaud's, what exactly it is, and how to better understand what's actually going on for everyone who suffers from this. We're also going to learn how to reduce the risk of flaring, sort of symptomatic management, as well as some general medical management. And then also some tips of when you should recognize symptoms are severe enough that you should be talking to your doctor, not just in clinic, but also on a more urgent level. And then on the Sjogren's side, we'll talk about kind of a basic understanding of what Sjogren's syndrome is, as well as learn some of the basic management that you can do at home as far as management of dry eyes and dry mouth. And then for both, very, very briefly touching on some more advanced treatments, but I think generally kind of focusing in on some of the earlier things that you can certainly do in the comfort of your own home. And so what is Raynaud's exactly? Whenever you go to your doctor, your rheumatologist, they may ask you this kind of series of questions is, do your fingers change colors with the cold or in any other kind of scenario? And generally it is this sort of progression of white color changes of the fingertips or the toes, going to a purple color change and then potentially a red color change. And what we understand about this is we have blood vessels, of course, that come from our heart and travel all the way down to our fingertips. And there is, in people who have Raynaud's, there is an exaggerated response of the blood vessels. So the blood vessels normally are very open, but in certain individuals, they will start to spasm. So they'll start to open and close, kind of like a garden hose. And when there is that pinching of the blood vessels towards the tips, that causes these color changes and symptoms. So think of it as kind of a decreased amount of blood flow, very temporarily reaching the fingertips or the toe tips and causing these color changes. And here is a diagram to kind of better visualize this. And so you can see here on the left is a normal hand and normal blood supply. And you can see, again, these blood vessels here on the left are nice and open. And you can see that the blood flow and the oxygen is reaching all the way to the fingertips. This is in contrast to the right picture, which is a hand that suffers from Raynaud's, where you can see that this blood vessel here on the right is much more narrow. So there's that spasming that's occurring. So there's kind of a opening and closing that is happening that is limiting the amount of blood flow and oxygen that is coming to the fingertips. Again, very temporarily. And because of these temporary changes, we're getting these color changes. Now, this white to purple to red, while that's very classic, and if you Google these symptoms, that's what all the textbooks will say is the progression of these symptoms. Not everyone has actually all three of these colors. And so everyone is a little bit individual in terms of, one, does it affect the hands and the feet? Does it affect certain fingers? And then what color changes they actually experience? And so in addition to these color changes, what are other symptoms that come with it? So when the color changes are occurring, a lot of people report that their fingers will feel cold. So there's less warm blood that is traveling to the fingertips. Because of this, it also can be very uncomfortable. And that discomfort can range anywhere from true pain to more of a numbness and a pins and needles type of situation. Think of it as akin to your arm falling asleep and that sort of numbness sensation. And the important thing, and the part that I keep stressing, is that, again, all of these symptoms are temporary. So your symptoms, the pain, the numbness, it should resolve as the color changes improve. And usually this occurs after the kind of trigger is removed. So this cold or this emotional stress that causes the Raynauds, it gets better as things are eliminated from the environment. And so who gets Raynauds? So it's actually a relatively common symptom. It affects about 3 to 5% of the general population. And the important thing to remember is it can happen both in isolation, so it can be the only symptom, and it also can occur very commonly with autoimmune diseases, such as lupus. And it actually is one of the more common symptoms in lupus, with about 1 in 3 people reporting that they have Raynaud's in association with their lupus. That being said, like I said, it can occur by itself, and generally more commonly, it will occur in isolation in individuals who are a little bit younger and usually more women. But as I think many of you know, that's also our lupus population as well. So it's not something that you can entirely rely on, and certainly can warrant further investigation by your doctor. And so moving into what you and your doctor can do to help reduce the symptoms. So like I said, Raynaud's is driven by this blood vessel spasm, and the things that trigger it are the things that trigger your blood vessels. So cold temperatures is a big trigger for flaring, and keeping things warm is the most important thing. And when we say keep things warm, it's not just your hands and your feet that you should be keeping warm, but actually your core as well. If you think about it, whenever our body is in a cold environment, the blood vessels clamp down, they stricture down, no matter who you are, just to keep all of that warm blood close to your center, to keep your heart, your lungs, all of your organs warm, and will kind of shunt blood away from your fingers and toes. The same thing happens in Raynaud's, but on a much larger scale. So keeping your core warm helps teach your body that it's okay to kind of keep things relaxed and keep the blood flowing to your hands and feet as well. The other things that you can do are avoiding other triggers that will cause blood vessel spasms. So smoking, nicotine and tobacco is a big trigger for this. That can cause a lot of spasming. So the more you can eliminate smoking, both from a Raynaud standpoint and from a general health standpoint, is obviously very important. Caffeine is another trigger for a lot of people. And so reducing the amount of caffeine that you are intaking, taking in more decaf beverages as well, all can help with your symptoms. And then I think the hardest one for many people is reducing stress, because stress, of course, kind of activates that fight or flight response in ourselves. And again, that causes that clamping down of our blood vessels. And so any way that you can move into a more relaxing environment, reducing the stress in your life, can also help kind of relax those blood vessels as well and keep things open. Now, of course, for everyone, symptomatic management doesn't work for everyone. Sometimes medication is kind of the next step. And that's when it's important to talk to your doctor for two reasons. One is there are certain medicines that people take that can actually cause these blood vessels to spasm. Most common ones that we typically see are a medicine class called beta blockers. Those are very common blood pressure and medications, heart medications. Some people take them for migraines as well. So talking to your doctor if those are necessary or if they can be reduced. Another very common medication that we see are decongestants. So if you think about it, decongestants work by narrowing the blood vessels in our nose to reduce the swelling and the amount of blood that is pooling there. But a lot of these medicines, they work in all places. So trying to eliminate those as well can be really helpful in reducing the amount of spasm. On the flip side of that, medications that can a lot of the other medications that we use in autoimmune disease. So there's no increased infection risk with this, which is very nice. And then finally, when should you talk to your doctor in a more urgent way? So certainly if you have more bothersome symptoms, so symptoms that are not responding to medication and causing a lot more pain than is tolerable. Another important scenario is when you're starting to see evidence of damage. Now, when I say that, not everyone with Raynaud's will get actual damage, but in the individuals that do, think of it as a consequence of the lack of blood flow to the fingertips. So that lack of blood flow can cause things like ulcers on the tips of your fingers. It can cause some damage and breakdown of the skin. And then in a very small group of people, that damage can progress and actually cause death of the cells at the fingertips, which of course can be very painful and certainly is something that needs further evaluation. And then finally, like I've been stressing, most Raynaud's should resolve after a period of time. So if you warm your hands, if you take your medications, the blood vessels relax and the blood flow returns. In a very rare complications, that does not resolve. And that, of course, is more of an urgent emergency to talk to your doctor about. But again, that is a very small subset of people who have Raynaud's. And here are some pictures just to kind of describe the type of damage that I'm discussing. So you can see here on the left is an example of an ulcer that occurs at the fingertips. And then moving towards the right in that middle photo, you can see there's some skin breakdown and that can occur. And then finally on the far right is kind of that end consequence. So the actual death of the tip of the finger. And of course, once it reaches this point, that's not something that we can salvage with medications. And so the important thing is to try to open things up and prevent things from progressing to that point, because that's not necessarily an ultimatum. That doesn't have to happen if we intervene early. And then finally, very briefly, moving into Sjogren's syndrome, because I think this is a little bit of a bigger black box for folks at times. And so when we say Sjogren's syndrome, we are talking about an autoimmune disease that primarily affects the glands that produce moisture, so specifically saliva and tears. And what happens is our body attacks these glands and prevents our ability to make the saliva and the tears. And so because of that, the patients who have this suffer from a lot of dryness, both in the mouth and in the eyes. There's also dryness that can affect other places. Some people complain of vaginal dryness in particular, and it can also affect other organ systems, just like any of our autoimmune diseases. And I think that's a little bit beyond the scope of what we'll be talking about today, but I think primarily dryness is the big symptom that most people will report if they have Sjogren's. And the important thing is with Sjogren's is that it is the most common autoimmune disease to occur with a second autoimmune disease. So it very commonly occurs with things like lupus, thyroid disease, et cetera. And so it can occur in tandem with two different things. And so how do you know if you have Sjogren's? So often we make that diagnosis primarily based on symptoms, so things that you tell us in clinic. And when we're talking about symptoms, we're talking about primarily the dryness. And when we talk about dry eyes, we'll be asking, okay, so what sort of dry eyes are you experiencing? What time of the day? Are you requiring eye drops? The dry eye that comes with Sjogren's is often pretty relentless, and people usually report requiring eye drops multiple times a day. They may also get a lot of irritation or scleritis around their eyes, that redness, and it can be very, very painful. With the mouth, again, mouth dryness, it's going to be throughout the day. People are going to report needing a lot to drink. And then because they lose that sort of protective saliva within their mouth, they may actually report a lot of cavities and dental infections as well. And then finally, a symptom that we very commonly see is swelling of these glands when that inflammation is occurring. And our saliva glands are primarily affected, and those typically sit kind of around the jaw towards the back of the ears, as well as we have several beneath our jawbone, right kind of at the base, at the top of the neck. And so sometimes people will see temporary swelling of those. In terms of diagnosis, your doctor may order other tests to confirm this. There are some certain blood antibodies. Some of them can come with lupus as well, referring you to an ophthalmologist or an eye doctor to do some specific dry testing. And then certain people will also get a biopsy of the inside of their lip to kind of help confirm if the diagnosis is in question. Although I will say with the kind of asterisk that all of this testing is not always essential. And so often we do go by symptoms alone because a lot of the management is by symptoms anyways. And as that kind of is a good segue into how do we manage and treat these symptoms. So like a lot of autoimmune disease, there is no quote unquote cure for Sjogren's. And we primarily focus on controlling symptoms, reducing damage, and helping kind of improve quality of life as a whole. And the same goes with Sjogren's. So with the dry eyes, the things that people usually start with are with eye drops, primarily artificial tears. You can buy a lot of these over the counter. It's very important to kind of look at the brand that you're buying to avoid any sort of preservatives, because preservatives can be very drying to the eyes and kind of fight against what you're treating. And then if that is not enough, you can talk to your doctor about special medicated eye drops as well that are a little bit more potent. You can also talk to your eye doctor about putting these things called tear plugs in. And tear plugs, think of it as essentially like a bathtub plug, where you place the plug in the drain and it allows that moisture to fill up in your eyes a little bit more efficiently than it would have been previously. For the dry mouth, there's also kind of very similar things. So most people start with sugar-free candy or gum just to help stimulate the salivary glands. Particularly sour food or sour candies are particularly helpful for this, but really it's kind of your choice there. Artificial saliva is something else that you can buy over the counter to help stimulate your saliva flow. And then finally, there are medications you can talk to your doctor about increasing the amount of saliva and tears that you're producing. We don't usually start with these just because they can have a little bit of extra side effects. Primarily, the most common one usually people complain about is excess sweating, because you can think it's producing moisture everywhere. But certainly it is an option in certain situations if these measures are not enough. And so that's all I have to talk to you all about today, but I, again, appreciate all of your time, and I'm happy to take some questions at the end of the presentation.
Wonderful. Thank you so much, Dr. Kaniecki. Your presentation was wonderful, and I definitely learned a lot. I'm excited to get into this next portion of our event by really diving into some questions that our audience may have. So I'd love to turn it back to Dr. Kaniecki to kind of maybe go back to, we lost you for a little bit earlier today. I know there's a storm coming in, so I appreciate you being able to kind of circle back and maybe kind of focus on that slide that we missed. And everyone in the audience, please correct me if I'm wrong, but I believe it was the medication slide that I'd love to kind of maybe focus a little bit more on.
Yes, of course. Sorry about that. Like she said, the storm may have caused some issues with my internet for a moment. But let's see. The medications for, here we go. But yes, essentially what the point of this slide was kind of two buckets. One are, there are certain medicines that can worsen Raynaud's, and there are certain medicines that can help. And it all comes down to what medicines do to blood vessels. And so in the bucket of medicines that may cause worsening symptoms are the medicines that cause worsening blood vessel spasm. And the two that I had listed here are the beta blocker medications, which are very commonly used in heart disease. Some people take them for their migraines as well. That's a common medicine that might cause a worsening of Raynaud's symptoms. And then decongestants are another big class of medicines that you can often buy over the counter. And the way I describe this is decongestants work by reducing the size of the blood vessels in our nose, and that reduces the swelling in our nose, which is very helpful from a congestion side of things. But these medicines often work in other parts of our body as well, and that's how it can be an issue with Raynaud's, is it can cause that constriction and that spasming in our fingers and toes as well. And then on the flip side, the medicines that you can talk to your doctor about helping with Raynaud's are the most common that we use are the calcium channel blockers. That's a group of medicines that are often prescribed for blood pressure. And the way that they work is by relaxing the blood vessels. And you can imagine it's helpful for blood pressure because it relaxes things and things aren't as tight, but that can also have a benefit for Raynaud's as well. And the nice thing about a lot of the medicines that we use for Raynaud's, all these sort of relaxant medicines, are unlike many of the medicines that we use in autoimmune disease that lower the immune system and kind of increase that risk for infection. These medications don't have that effect. So there's no increased risk for infection with a lot of the medicines we use for Raynaud's, which is very nice. I believe that was the crux of that slide, unless there was anything else, Leanne, that was missed.
Yeah, I think that covered the slide from as far as I saw you frozen. And
Okay.
I think that really kind of ties me back into a question that was thrown into the chat on really reducing Raynaud's symptoms. You talked about the medication, but are there any surgical approaches for appeasing Raynaud's symptoms?
Yeah, so with I think like a lot of autoimmune diseases, there's a lot of things that have been proposed that aren't necessarily studied very extensively. I think the surgical procedures that are talked about the most are this procedure called a sympathectomy, which is just a fancy word for saying a surgical procedure to cut the nerve supply. And the sympathetic nerves are the nerves that control spasming in muscle and in blood vessels. And so the idea is if you cut off that supply, it might help reduce the spasming that occurs, and they try to cut it kind of at a distal point where it's not affecting other areas. Whether or not that's successful is, I think, harder to say. I think where people see it might having the most benefit is in those severe situations that I mentioned, where things are not getting better with symptomatic management. So the color changes are staying and persisting, and they're not resolving. And that's usually more of an emergent situation.
Okay, great. Thank you. That's so helpful to understand. Kind of switching to another question that may be more focused on SLE or Raynaud's is really kind of the crux of this question is the redness in a face, for example, related to lupus itself or to Raynaud's?
That's a great question. So I think a lot of us are familiar probably with the butterfly rash of lupus. So that sort of redness that comes on mostly with, when the disease is active, but also with sun exposure. That is very classic for things like lupus. I will say that there are some people who actually develop Raynaud's in the nose, which can cause these color changes, but that would not exist just as redness. You would actually have either the white or the purple and kind of that same sort of sensations as well. So not a painless rash, but it might be tingling, it might be numb, it might be a little bit painful. And again, more of that white and purple that might be followed by the red afterwards.
Great, thank you. That was really helpful. Something else that was added to the chat is another symptom that a daughter of someone who is on the call is facing is tooth resorption. I was wondering if you've seen this symptom in any of your patients, or if you could just shed any light on that.
I think it's not very common, at least in the patients that I've seen, although it certainly can happen. I think where I've seen it happen are the patients who have very severe dry mouth to the point where they have a lot of dental disease. And any sort of dental disease, while it may not look like a acute infection, that sort of chronic infection can cause a lot of damage to the teeth long term, and that sort of recession as well.
Okay, great. I'm glad you added that dry mouth note, because that was also added to the chat as our great audience members are kind of interacting in the chat about potential dry mouth on the Sjogren's side of this. And then now focusing on Sjogren's just a little bit can Sjogren's cause nerve damage?
Yeah, so absolutely. So Sjogren's, like I said, is a bit of a black box, and honestly kind of like lupus, where there's a lot of different manifestations and everyone is a little bit different. I think the most well-defined nerve damage that we understand in Sjogren's is something called small fiber neuropathy. So we have different size nerves in our body. We have large nerves that, they start in our brain and they come off of our spinal cord, sort of these medium-sized nerves, and then small fibers, which are like very tiny, almost microscopic nerves. And that's how we really sense, we have any sense of sensation on our skin, temperature, et cetera. And so certain people with Sjogren's can have small fiber neuropathy, where those very tiny nerve fibers are affected. And it's not classic in the sense where you biopsy a nerve to figure this out, but you actually have to biopsy the skin and try to capture some of those nerves in that skin biopsy itself to help diagnose it. Okay,
great. And then still focusing on Sjogren's syndrome is, I know you talked about kind of reducing symptoms, but are there other outside factors like wind and sun and light that can impact kind of that dry eye and dry mouth? I'd love to kind of hear how those other factors play a part.
Yeah, I think environment plays a big part in a lot of this. I think less so light and light, just although we think of a lot of that with lupus, but more so the actual humidity of your environment. So a lot of individuals might report that their symptoms are particularly bothersome at night. And that might be something that is helped by using a humidifier at night and trying to keep the environment itself moist. And so I would say it's more a question of humidity rather than like light or wind.
Okay, perfect. That was really helpful. And I think it's always important to understand those environmental factors that play into a part of managing disease. I don't see any other questions now. So if anyone does have any other questions in the chat, I'd love to hear your feedback. It's great to see the conversations taking place in the chat and the advice given to each other. And to reiterate as well, I really appreciate the feedback everyone's giving of how journaling has really helped your individual lupus journey. So thank you again, Tatiana, for that wonderful presentation. Dr. Kaniecki, is there any other kind of lasting advice you would like to share with our community here tonight, just about kind of managing your Raynaud's and or Sjogren syndrome, kind of as they kind of go on with their evenings tonight?
Yeah, I mean, I think at the end of the day, we really rely on all of you as your doctors to kind of tell us what's going on. And so if there are symptoms that are really interfering with your day-to-day life, certainly let us know, because we obviously want to help and try to make things more comfortable. And I know both of these things can be, while they seem small on like a presentation level, certainly can cause a lot of issues with your day-to-day life. And so I think kind of tying this in with journaling, figuring out what is important in your life, the things that you want to do. For example, I had a patient who the only thing she wanted was to be able to go fishing with her husband, and how could we make that happen with her Raynaud's? And so coming up with a plan together with your doctor about how to, how are we going to combat this and try to make life the most worthwhile, I think is really important. And I think journaling can be a big part of that, just to focus yourself and then bringing it to your doctor just to come up with a plan of attack, so to speak.
Amazing. Thank you so much for that advice and for that kind of final words of wisdom as we approach the end of our event tonight. And thank you so much to the rest of our speakers for attending tonight and for your wisdom and for your advice. I'd love to just share my screen quickly to share a post-event survey with you all. Your feedback is highly valued and really helps me shape future programs. And I'd love to know what you thought of today's event and hear more about what type of content you'd like to see in the future. I added the link into the chat, but also have the QR code up on the screen if you wanted to take out your phones and hover over the QR code and it'll take you to this survey. I'll also follow up with an email with this event recording, as well as our post-event email or post-event survey as well for this feedback. And again, thank you so much for our amazing speakers who joined tonight, and to all of you who signed on out of your busy days. I really appreciate it, and I hope you have a wonderful rest of your evening and a great rest of your week. Have a good day. Bye-bye.